Hello, everyone. I'm Dani, and welcome to our podcast. Today, Great.com talks with Mary Jen Polzello, the managing director of the Tom Coughlin Jay Fund. If you don't know them yet, they're a foundation that offers financial, emotional, and practical support to families tackling childhood cancer. If you're new here, remember to press subscribe on YouTube or in your podcast app. Hi, Mary. Welcome to our Great Talks.
Hello, Dani. How are you? Thank
I'm
you for
great.
having me.
Oh, honestly, our pleasure. I love talking about this subject. I once had a brief experience working with some kids tackling childhood cancer, and I gotta say that was an experience that completely shaped me. I've been working with them for a year, and that gave me such a broader understanding of how cancer can affect the family, because we always think about the patient suffering and all that, but I understood that the family kind of needs to reshape itself, right, and re-understand the way they're going to live life. Right. So it's really important for me personally to talk about foundations that work on that. And I was checking you guys out, and I very much loved the way you shape. I'm using shape a lot, but that's the way shape your help to this cause. And I want to highlight here that I said that you help families tackling childhood cancer, because that hits to your background. So can we begin with you telling us about the story, how the fund began?
Surely. And I couldn't have said it better myself. Exactly what you said. When cancer strikes a family, it's not just the patient, it's the entire family. So kudos for you for realizing that with your experience. Yes. So Coach Coughlin, Tom Coughlin, used to coach the New York Giants, but before he coached the New York Giants football team, he was a coach at Boston College. And Jay McGillis, who the Jay Fund is named after, played for Coach Coughlin. And unfortunately, Jay was diagnosed with leukemia, and about 9 months post-diagnosis, he passed away. So Coach realized and saw firsthand what the diagnosis, how it devastated the McGillis family, his sister, his brother, his parents. And he said, if I ever get to a point in my life where I'm able to help families like Jay's, I will do it. So fast forward, he became the coach of the Jacksonville Jaguars down in Florida. And about 26 years ago, he started the Jay Fund down there. So we help families also in Northern Florida, Southern Georgia. And then when he left the Jaguars, he moved to New York, and he became the coach of the New York Football Giants. So he also started the Jay Fund in New York and New Jersey to help families tackling childhood cancer. So tackle comes from, obviously, New York football and Jacksonville Jaguar football. And that's really how it started. So the thing that strikes me all the time as a parent is that Jay McGillis's memory lives on through all of the families that we helped and have helped and continue to help. And the McGillis family is very involved with the Jay Fund. Jay's brother is on our board. His sister is very supportive. Unfortunately, Jay's dad passed away last year, but his mom is still with us, and she is very involved also. The Coughlins and the McGillises have a very close family, and obviously they appreciate all that we're doing for families in Jay's memory.
Wow, I think this speaks a lot about how involved you are with the families, because it began with a family relation, right? And that makes the whole difference. It's not like coming from someone that don't know, they're not close, they're just disconnected, and that makes the whole difference. Mm-hmm. And in that, what are the programs? How do you actually help people in that situation?
Right. So if a family is diagnosed with a cancer, childhood cancer diagnosis, if they're told that horrible news that nobody wants to hear, they are usually in a hospital, obviously, a facility of some kind. So they would go to their social worker and say that they're looking for some help, either financial, which is our biggest bucket of help that we offer families, or emotional support or practical support. However they need the help, the social worker would direct them to the Jay Fund. And then they would apply, send in a very brief, easy application and say, this is what we need help with. And on the financial side, we help pay emergency household expenses. So we will cover rent, mortgage, utilities, car payments, phone bills. And we like to say, Danny, that we help families keep a roof over their head, food on the table, and the lights on. And that's exactly what we do. Very often, as we all know, cancer diagnosis is not only horrible, but it's expensive. And the average cost associated with childhood cancer is a staggering $833,000. And the problem is when a diagnosis is handed down, one of the parents usually has to either stop working or reduce their hours, and therefore the financial burden becomes greater. A lot of our families are not doing great financially to begin with, and then you top it with a cancer diagnosis, and that's where it starts to snowball and get out of control. So the J Fund comes in and we say, whatever you need. We're most proud of the fact that we never turn a family away. If a family fits within our guidelines, we never say no. We will help no matter what during their diagnosis, during their treatment, and then even 6 months after their treatment, we will help. Because as we all know, just because the child hopefully gets into remission, the bills keep coming. So families continue to need help financially. And then emotionally, we offer events for families, for patients. And what you said in the beginning is exactly what we do. We invite the parents, the grandparents, the siblings of the patient, because the focus is usually always on the patient, but the caregivers really suffer greatly because all their focus is on their child. So the J Fund likes to be there for parents so they can in turn be there for their children and their families. And then we also offer programs for siblings, for survivors, for adolescent and young adults, and as I mentioned, for caregivers. And that's really our focus this year is caregivers. We just always want them to take care of themselves because, of course, if they're not in great shape, everything's going to start to crumble. So although they don't like to admit it, they do need help and they do need to take care of themselves. So those are just a few of the things that we offer to families. And it's a pretty comprehensive support that we offer. I don't know many foundations who do what we do, and not to pat ourselves on the back, but we are always there for families financially. As I said, that's the most support that we offer, and that's most important, and that's what everybody needs, and we're there to do that. But the Make a Child's Life Brighter is what we call. It gives families a chance to kind of forget, not that they can forget, but just takes their mind off of what they're going through for a few hours. Come to a football game, go to a party, something like that. Come out to dinner. We're having a Mother's Day event, a Father's Day event. So those are things that are really important because mentally, physically, they're drained, obviously. And if we can alleviate and relieve some of the financial burden, then that in turn helps them with everything else.
Yes, definitely. And honestly, you should pat yourselves in the back because it's honestly a privilege to actually be able to provide this amount of care and be this comprehensive, because as I said, I don't think we fully understand that until we get in touch with it, until we actually meet people in that situation. We understand how the families need to reconfigure. And I think you kind of get into this disease mode, I would to think on that, where everything is just super scary and you kind of learn all these medical terms out of sudden, and you're just checking medicines, and then your mind just go into this void of fear and stress and frustration. And it's completely necessary to have other people with a structure saying, hey, come back.
Right. And the other key point is when we have these events, they're not just to, run around and have a good time. That's good for the kids and the patients and the siblings, but for the parents and the caregivers, they get a chance to connect with other caregivers and other parents going through the exact same thing. So they're not alone. COVID was a real tough time. The pandemic was a tough time for our families, especially. It was tough for everybody around the world, of course, but our families live COVID every day. They live in isolation. They live in fear. They live in worrying about their immunocompromised child, and they don't want to go out, and they didn't want to get germs. And some of our families, I was at an event last night for Mother's Day, and that some of the moms were still wearing masks. And we 100% understand. They just cannot take a chance of bringing anything back to their kids who are going through treatment right now. It's too scary and too dangerous. So I think reaching out and being with other people that are going through the same thing, traveling the same journey, and those friendships and relationships stay, whether they have an unfortunate outcome with their child's diagnosis or whether they hopefully have a positive outcome. Regardless, they're always part of the Jay Fund family, and they will always be in touch with these families and these parents and caregivers because they went through this together. And we're just thankful that we're able to be here to supply that opportunity for them to do that.
Well, that's wonderful to hear. Now, if you don't mind, I want to highlight a few things on your programs that I've noticed before when I was doing some research. And well, one thing that I thought was great is that you not only worry about, okay, I'm going to give you this amount of money and then you're going to pay your bills and do whatever. You have a concern, a guideline to try to help people understand the finances. And I love the idea of the game planning.
Right. Yes,
for the
it's very
finances.
important.
It's totally necessary. And the other thing that I loved to just read about, and I would like actually, if you could just say a little bit more about, was the Jay's team. And Jay is standing for Just Among You Siblings. I think it's a great idea. Can you tell us more about that?
Yes. So that program is the two programs. So the financial planning, financial coaching is basically we offer families because they're overwhelmed. Obviously, they have 1 million bills to pay. They had 1 million bills to pay before the diagnosis was given to them and their child. And now what do? Do we pay cable? We obviously have to pay our mortgage and our rent, but can we get rid of a car? Can we downsize maybe the house? Can we get rid of all the 500 cable stations that we have? So when they reach out to the Jay Fund, we put them in touch with a financial coach, and they're able to advise them and tell them what's the best way to go about doing the things that they're doing, paying what they have to pay, and then maybe putting things on the back burner that they don't absolutely have to pay. So that really puts everything into perspective for the families. They line up all their monthly expenses. What do you have to pay? How can we do it? What's coming in? Who's working? Who's not working? That kind of thing. So that is invaluable because nobody's thinking straight when they get that diagnosis. You go into a whole other realm in your brain, I can only imagine, but what I've heard from parents saying, we don't hear anything after your child has cancer. That's all they're able to focus on. So if somebody sits down with them and says, bring us all your expenses and bring us your income and let's figure out how we do this. And then it's not forever. This is a period of time that you have to struggle and you have to get through this, but we're here for you and we will help you. And hopefully it's short term and you'll be able to get back on your feet again at some point. And this will all be in the rearview mirror, hopefully, is what they're thinking. So Jay's team is for siblings. And as we said, we think it's just as important that the siblings realize that we're there for them because, as I said, the focus is usually on the patient. And the siblings before COVID, now nobody's allowed to go to hospitals or doctor visits, but they may have been brought to the hospital or brought to doctor's appointments, and they're not able to do the things that they want to do. So we have these events that all the siblings come, and they get, just as the parents and caregivers get to meet other parents and caregivers, these siblings get to meet other siblings that are going through the same thing. So then they don't feel so alone and so weird and so strange. All of these people have a sibling, unfortunately, with a cancer diagnosis. So, and kids will be kids. They are able to do artwork or cooking classes or, whatever our program team, which is an amazing program team in both Jacksonville and in New York and New Jersey, especially during COVID and the pandemic, we had to pivot. That word was used so frequently, but honestly, we pivoted very quickly to supply virtual programming for families. So everybody was home, everybody was on their computer. We figured, let's not hesitate. Let's make sure the families know that even though we can't see them in person, we can't visit them in the hospital, we can't have a party, we are there for them. And we're there for their siblings, and we're there for their caregivers, and they're not alone. And although they felt isolated, and sometimes the siblings feel isolated, we try to do as much as we can to make them realize that we're there and they're not alone.
Wow. Again, kudos. It's a huge effort, I can see. And I kept wondering here, because I honestly would have no idea, truly, how this COVID pandemic would affect you so much, because, it has affected everybody, but I feel like there's a certain groups that the toll was bigger. And besides that, but considering that as well, what kind of challenges do you daily face in this, trying to provide this support?
The first thing is families and parents, caregivers are very proud people. Sometimes they don't want to ask for help. They think the help is for other people who need it more. So we try to convince families that everybody needs help and everybody is entitled to help. And the Jay Fund is there for everybody. As long as I said, you live in the guideline areas, you have a diagnosis, your child is between 0 and 22 years of age, and you're currently going through treatment, you're able to receive help from us. So that's one of the challenges. But I think if you go back to the pandemic was our greatest challenge so far. We wanted to check in with families. We wanted to make sure they didn't feel isolated. We wanted to have these meaningful virtual events. We wanted to connect with our donors. You can't forget about the donors during pandemic, because you need them now more than ever. So we did virtual fundraising events. We did whatever we needed to do to make sure. And a lot of foundations closed their doors, unfortunately, or said, we can't do it anymore. We can't raise the money because we can't be in person. And the Jay Fund continued to support. We are not lying. We say we are going to be there for families, and we are going to be there for families, whether it's today, tomorrow, 10 years from now. That is our plan, and we will always be there for them.
Oh, I get it. And taking this point of talking about donors and getting to, unfortunately, the end of our interview, what is the best way for people to help you guys keep going?
Thank you for asking, because we need help all the time, obviously, to keep going and keep being able to support our families. Our website is tcjfund, Jay fund.org. It's not .com, it's .org. And you can go there and see exactly the work that we do. You can donate, you can volunteer, you can help in any way possible. And as I said, we have locations in New York and New Jersey, and we also have locations down in Florida. And so any kind of help that you can assist with is greatly appreciated for our families, because they are not out of the woods as far as COVID goes. There are some places that COVID's not really on the front burner right now, but our families are still have been devastatingly impacted by COVID. So we have to raise more funds and more money than ever before. And, again, cost of living is, some of the highest rents in New York City in history. They're historical highs. Gas prices, as we all know, are incredibly, have skyrocketed. So to get to and from treatments, to get to and from doctor visits, these are the things that our families are facing, these challenges, that if we can just be there to take a little bit of that financial burden off their plate, then we feel good and we've done our job.
Oh, so you've heard, people. Let's help out. Okay, please reach out and help them keep doing this wonderful job. Thank you so much for joining us today, Mary.
Thank you, Danny. Really appreciate it.
Our pleasure, honestly. And
thanks for having me.
And for everybody else listening, thank you again for another episode, and you're still here. And I see you at the next episode. And remember, if you liked what we talked here today, press subscribe, press the like in YouTube or in your podcast app, because that shows the algorithm that this is an important conversation and more people can learn about the importance of the Tom Coughlin Jay Fund. See you at the next episode. Bye.